I want to start by thanking Renee for being here, for taking the trip out to Washington, D.C. for this joint address, but also for having the courage to tell your story. It means so much, and it's a really powerful story to tell. And I wanted to just make some introductory remarks. You know, the beginning of this administration has been riddled with chaos, and we've seen cutting of funds from life-saving research on cancer and Alzheimer's disease. We've seen our dairy farmers shortchanged and our veterans. We've seen the freezing of funds that have affected Head Start programs in our state and firefighters and fire departments across Wisconsin. And we have all seen in recent days and weeks, they are paving the way for massive cuts to the Medicaid program. And why? All to make room in their budget for massive breaks in taxes for billionaires. And behind each one of these announcements that we've seen coming, flooding from the White House, behind each new headline in the morning paper are real lives that have been upended, and people who are really frightened about what these changes might mean for their daily lives. And I'm hearing those concerns. My office has actually been hearing from thousands of folks per week. And just so you have a sense, it's average in a day for our Senate office in ordinary times to maybe hear from 50 to 100 people. We've had several days in a row where we've heard from well over 1,000 people per day. And we're hearing from thousands of people calling to share their stories, asking concerned questions because of what's happening right now. So just a couple of weeks ago, amid news that congressional Republicans were planning to slash the Medicaid program, one of the people who wrote to my office was Renee. Renee will tell you more about her story in her own words in just a few minutes. But I want to share with you what she wrote me to talk about what would happen if Medicaid would be ripped away from her. And I'm quoting her. She said she would be forced to ration or forego cancer treatment, said hastening my death, or send me and my husband into bankruptcy trying to keep me alive. And I just think about that. Let that sink in. If congressional Republicans really get their way and pass their bill that tees up more than $800 billion in cuts to Medicaid, Renee won't be an outlier here. That plan would rob seniors and children and people with disabilities the means they need to take care of themselves, and all in service of cutting taxes for billionaires and the very wealthy. It would substantially harm the program that Renee relies upon to get the treatment she needs to live. And it would gut the program that helps almost 2/3 of all people in nursing homes have a safe roof over their heads and the care they need. And it would gut the program that provides healthcare to over 70 million Americans, including 1 in 3 children and 8 million seniors. And these cuts will hurt all Wisconsinites. Whether you're on Medicaid yourself or you have a parent who relies on Medicaid, or somebody who you're sitting next to at church or at temple, or a friend of your kids at school, I can guarantee that these cuts will hurt us and our neighbors and our friends and our communities. And it's why I'm so proud that we have Renee attending the State of the Union this evening. So I've heard the president claim that he supports Medicaid. Just even last week, he was on Fox News and he said, I won't touch it. And then the very next day, he flip-flopped and endorsed a plan, the House Republican budget, that would slash Medicaid by hundreds of billions of dollars. So I wanted Renee to be here to show him what his cuts to Medicaid would mean to Wisconsinites. Show him that his tax cuts for his wealthy friends will be life and death to some Wisconsinites, and show him that it is not worth it to do so. So I will fight at every turn against stripping away healthcare from families and resources out of our communities, all to fund tax breaks for their wealthy friends. And I'm honored to have Renee here, sitting next to me right now, and sincerely grateful for Renee's willingness to be here. Now it's
my turn.
Your turn.
Well, thank you very much for inviting me. It's an honor. I really appreciate that I got listened to. You can get the standard form letter when you make a call or send a letter. Tammy took the time to really listen and really learn what happens when you talk about a policy decision. Talking about money and looking at spreadsheets is really easy, but when you see a face to this, it really hits home on what these policy decisions do. A little bit about me. I'm a Milwaukee, Wisconsin resident, 60 years old, and am a stage 4 metastatic breast cancer survivor. I have tumors in my brain, my lungs, and my liver. I am also a Medicaid recipient. Without it, I would not have access to a highly qualified cancer team that has been supportive of me and has been giving me the very best treatment I could ask for. They've been so essential to me. Without Medicaid, I will either become uninsured or underinsured, which means I have to make very tough decisions. I have to think about, do I have to ration my care? Do I have to forego treatment for longer than what is recommended so I can afford it? Do I follow the medical advice and do it and just pay for it out of pocket, which then puts me and my family at increased risk for medical bankruptcy? We've saved for our retirement, and that will go away if I have to start paying for incredibly expensive cancer treatment for stage 4 cancer. So those are the questions that I sit with in my house and think about. Instead of thinking about how can I make myself healthy, I think about how can I afford this instead. It's a horrible feeling. And I shouldn't have to be thinking about this. If we're the greatest nation on this earth, we should take care of our most vulnerable. And Medicaid is key for me. And I'm not alone. I'm not alone. I know of individuals with disabled children. I know of mothers and fathers who have their mothers and fathers in nursing homes and rely on the Medicaid system while their elders are in nursing home care. I'm from a rural area of Wisconsin formerly, and I know that the health clinics there will struggle immensely to provide services if they don't have Medicaid funding. So it's going to impact people whether they're on Medicaid or not.
Thank you.
But I want to thank you for championing this and taking it on, because it's a tough fight.
It is, but that's why we fight together. And, it's personal for me too. My mother was on Medicaid in her senior years. And I know what a difference it made to her and our family, that it was there. And so, yes, this is a fight worth tackling.
Great. We'll do
Yes.
it.
We will.
Terrific. Thank you very much, Renee, for sharing your story with us today. And now we'll have time for a few questions. So press folks on the call, please submit any questions you have to the Zoom through the Q&A function. All right, and Senator, we'll start with this one for you. Republicans have time and again said they aren't making cuts to Medicaid and have said you are fear-mongering. What is your response to that?
Well, first of all, we've seen the House Republican budget resolution, and it calls for nearly $900 billion of cuts, most of which will focus on Medicaid. And that is far beyond what could be explained away by going after fraud, waste, and abuse. And let me be really clear. I want to go after fraud. I want to go after wasteful spending. I want to go after abuses in any system. But we're talking about something on a totally different scale. And let me also say that if Donald Trump and Elon Musk were serious about these efficiencies and about going after fraud, waste, and abuse, they would not have terminated 17 inspectors general whose job it is to be sort of objective watchdogs, independent watchdogs over these agencies, vetting out fraud, waste, and abuse. But he fired 17 of them, including the one that was overseeing fraud, waste, and abuse in Medicaid. So it's clear that they are not serious about that. But look, this is calling for massive cuts in Medicaid. It's the key target. And I can tell you it's impossible to get to that level of cuts without affecting services in a very, very profound way.
Can I add?
Please.
I think everybody would agree that we want to address fraud, waste, and abuse. However, some of the proposals that I've read in the press that the GOP has offered don't target fraud, waste, and abuse. If you look into the Medicaid program, most of the fraud, the overwhelming majority of the fraud, is on the provider and insurer side of it. But the proposals on reducing it, eliminating Medicaid expansion funds, work requirements, and capping what the federal government gives to states, doesn't say anything about insurers or providers. Those are all services for recipients who are not the majority of the fraudulent bad actors. So I question and I'm unclear as to how these cuts and these strategies help fraud, waste, and abuse.
Thank you. Next question, Senator, what does it mean to have Renee attending the State of the Union this evening with you?
Yeah, well, it means a lot. Oftentimes when we're talking about challenges and we're talking about these big numbers, we're talking about nearly $900 billion in cuts to Medicaid. We're talking about 72 million Americans who are relying on Medicaid for healthcare and healthcare related services. Every single one of those 72 million people has a name and a story. And it's really hard sometimes to, let those numbers sink in. But to meet somebody like Renee and put a face to a face and a life story on it is really, really important. And when we have 1/3 of all children who are on Medicaid for healthcare, think of all those children, and each one has a life ahead of them, that we should be celebrating and making it easier for them to have every opportunity moving forward. And again, why are they doing this? Because they want to find room in their budget for tax breaks for the wealthy. The tax cuts that they're proposing disproportionately benefit the very wealthiest of our society.
And the next question is for Renee. What does it mean for you to be the senator's guest, and what message do you hope to get to the president?
I'm honored to be a guest. When I sent in my letter to share my story, I never dreamed I'd be here, actually in person giving my story to others. But I'm a fighter and I'm willing to fight. And so it's not just the president I want to give this message to, because right now he'll wait until he gets that budget and he'll sign it. So right now I'm focused on the legislators, because they're the ones who have the opportunity to do the right thing. And I want to let them know that this is Medicaid right here, a stage 4 cancer survivor who's willing to fight, I want to live. I want to be healthy. I want to have my health care. I'm very scared that I might not have access to my team anymore. So I'm willing to fight for it.
Thank you. And last question today, Senator, what are you hoping to hear tonight from the president, and what do you expect to hear?
I have to say that I want to hear something that remotely resembles accountability. Because look what we've seen in the first few weeks of this presidential administration. We've seen a president who has flouted Congress. I think about the checks and balances. It's Congress that passes budgets, passes appropriation bills, passes laws, and it's to be the president who implements them and administers them. And that's not happening right now. And there are unelected and unaccountable figures like Elon Musk who are taking a sledgehammer approach to cutting and firing employees and cutting and eliminating contracts. And so I want there to be some accountability tonight. I am not at all convinced I'm going to get that. But if nothing else, this president said he would lower costs for families. That would be on day one. This president said he would not touch Medicaid, Medicare, and Social Security. And so I know it's early in the administration, but I want some accountability there. And if not, it's going to be on full display. And we're going to be talking a lot about it in the days to come.
Terrific. Thank you very much. Hope everyone has a great day.
Thank you.
Thank you.